Hello, I'm David with Vascular Anesthesia. Today we're going to talk about NPO and the legal aspects of anesthesia. Stay tuned to Insomnia.
I fell asleep last night, wanted drops on my pillow. I have no peace of mind, and this might never change.
Hello, I'm David with Vascular Anesthesia. Today we're going to talk about a couple of topics. We talk about the fears of anesthetics being passed. So today we're going to talk about NPO time. NPO time is the time before surgery where you have to not eat or drink 8 hours before the surgery. Something real simple that a lot of people, they do and some people they don't. So let's explain the dangers, the benefits of doing it. Benefits of doing it is, one, it stops you from having aspiration issues. So what is aspiration? Aspiration is when food or water content, it goes down your lungs when you're receiving your anesthesia medication. When we induce a patient, induction means beginning of anesthesia, we give medications, fentanyl, we give Versed, we give propofol, and later we give you paralytic. So when you're stopping giving all these meds, it stops your gag reflex, and it stops you from, we take over your gag reflex, we take over everything. We start giving oxygen with a bag, which is a mask over you, and we use the anesthesia machine to put you to sleep. This is general anesthesia. So under general anesthesia, we blowing oxygen into your lungs, but some of the content goes into your gastric area, your stomach area. And if you got food in there, carbonated soda or water, if you push air in there, it's gonna come back up. And the contents that come up are very acidic. The stomach is the most acidic place on your body, meaning if you put anything in the stomach, I think the pH is like 3. It's gonna break down anything. It's straight acid. So you're taking the food that you just ate that's full of acid, and it's coming back up, and it goes into your lungs because you ate the night before. And if you do that, you can die. You can go to the ICU. You can be on a ventilator for months. You can be on a ventilator for weeks because you just aspirated contents of your gastric content into your lung area. And when this food comes up, it goes out of your stomach, from your esophagus, into your lungs, basically. And it'll be a problem, pharynx, larynx, into your lungs, into your bronchioles. And these small alveoli get filled with gastric content instead of oxygen. So when you start breaking down your ability to carry oxygen, your saturation goes down. And to break down saturation, your oxygen level goes down. You can't carry oxygen. And if you can't carry oxygen, you'll be on a ventilator. They try to give you some steroids to keep your alveoli open, but it doesn't work out to your liking most of the time. I've seen people go to the ICU, they live from aspirating, and I've seen people go to the ICU and they pass away because they didn't follow the instructions before surgery. So what we do, we try to, if you do that, you have a little aspiration, and you tell us that you ate, and if it's emergency, we do a rapid sequence, which is all the anesthesia medications with succinylcholine, which is a paralytic that acts very fast, goes on in less than 30 seconds. You're paralyzed, but it wears off. And then after that, we give you a regular paralytic if you're having general anesthesia. So we hold cricoid pressure here. The cricoid pressure will push down on the esophagus so food won't come up. So, but when you have a situation where the patient is lying and say, I didn't eat, and then they aspirate, you're gonna be in the hospital. You're gonna be very sick. You're gonna be there for weeks. And if you make it, it's going to be an experience you never forget. And you say, oh, it was because I had an anesthesia complication. No, it's because you ate. And you shouldn't have ate before your surgery. So doing MAC anesthesia, people aspirate also. They lie. They don't wait the 8 hours before we say, hey, we're telling you this for a reason, because you could die from aspirating gastric content. We tell you don't drink coffee, at least 4 hours, anything with color to it, any broth, any coffee, 4 hours before your surgery. Water, 2 hours. But we try to say 8 hours It cut off pretty much all your gastric juices or anything that's going to develop to stop you from aspirating. People who have diabetes, they just process food slower. They break down food slower. They have gastric contents always in their stomach. And if they eat, they're going to aspirate. So we tell you that for a reason. 8 hours, no eating, no drinking, no anything. You can take your medicine with a little small, very small, very small amount of water to take your blood pressure medicine or your metformin, whatever medication, thyroid medicine before surgery. But do not go and gulp down all this Gatorade or go eat a full meal, because people lie all the time. The first thing that, if you tell me that you ate, if you tell me that you drank, you probably ate. It's just like a smoker. If they tell you that I had a drink, I say, do you smoke? You say, no, I didn't smoke today. Yes, you did. You smoked. Because usually they go hand in hand. You're not finna eat something without drinking. So 8 hours, don't do it. I don't want you to aspirate. I want to keep you safe as we can. Even though you may have the urge to do it, please do not eat 8 hours before surgery. We are vascular. We provide anesthesia services for office-based anesthesia, ASCs, and even small hospitals. Thank you for the opportunity that you allowed us to come in to your families to service you while you're sleeping with excellence. Thank you. We are vascular.
We are vascular.
I fell asleep last night, drops on my pillow.
So what we're going to do, we're going to talk about a couple legal aspects of anesthesia. We have informed consent we want you to sign. We want to state patient safety, just in case before we give the anesthesia. Yes, there's a lot of things on that anesthesia form. You could die, you can aspirate, you can be paralyzed during regional, you can have a lot of asthma, it's attack. You can have a lot of things that goes on with the informed consent. Does it protect anesthesia? It doesn't protect, you get sued for anything. But it tells you before you sign, these things could happen. 99% of the time, they don't. 99.5% of the time, they don't. We're very safe practitioners. Everybody, they're safe. And they'll keep you safe. They'll do everything. They're not giving meds and just leaving the room. They're going to stay safe. Another legal aspect we're going to talk about is Stark Law. And that's big. A lot of people don't know about Stark laws and how medicine works. So, and it's not just an anesthesia. It's a war going on with docs against docs and patients and anesthesia and a lot of different aspects of business. You got businesses against business. You probably never think this in your life. You probably like, it's a lot of patients out here. It shouldn't be a whole lot of competition, but these business people, they're in competition with each other. And they go to extreme means of getting patients, and they go to extreme means of acquiring other businesses. But things that you don't want to do is violate the Stark Law that most people don't know about. Stark Law is basically providing kickbacks to to other physicians. Kind of like you grease my back, I grease your back. They provide kickbacks. I buy you this for exchange for this if you let me come into your clinic. We have some anesthesia providers do that. Kickback in Stark Law is some surgeons who they receiving payments from Medicare and they are doing what they can't make money off of. So you can't be a nephrologist and have an anesthesia group because you're indirectly making money. You can't directly do anesthesia and make money. And plus you can't be the surgeon and anesthesia at the same time. That's a violation of Stark Law. And you can go on the Office of OIG website and you can clearly see that. If you are doing that, you're breaking the law. If you are paying for, anti-kickbacks for you grease my back, I grease your back. It is against the law. So it's a lot of things that's against the law that even patients, some doctors get patients money, for coming in or this and that. It's against the law. It's anti-kickback. So just staying legal, it's in medicine, it's simple. Do the right things. So if you stay doing the right things, making sure you check with your healthcare attorney, I think if you practice right, everything will be good. Even if you are not knowingly breaking the law, you still can get jail time. You have these pain clinics that's just giving out meds and giving out a lot of prescriptions and misdiagnosing things and just treating it anywhere. That's against the law. It's a lot of malpractices going on in healthcare, and they're cracking down on it. It's not a game. There are doctors who've been going to school for 12, 13, 14 years. They're going to jail for committing fraud. So a lot of things that patients don't know, but these are some of the dangers of just dealing with healthcare and the industry of medicine. We are Vascular. We provide anesthesia services for office-based anesthesia, ASCs, and even small hospitals. Thank you for the opportunity that you allowed us to come in to your families to service you while you're sleeping with excellence. Thank you. We are Vascular.
We are Vascular.
I fell asleep last night, wanted drops on my pillow.
Last topic we're going to talk about is being overworked in healthcare. During COVID, healthcare workers are so overworked. The nurses are working. They're not even getting raises. Some of them getting bonuses. The hospital's not treating them right. They are giving them overtime instead of raising their rate. They're working them to death. They working 12, 16 hours. Some of them work 20 hours. And after a while, you become very unsafe when taking care of a patient, even as a nurse. When it comes to anesthesia, we have some anesthesia people that go 24-hour shifts, which is normal in some institutions where they're doing OB, they're able to rest at night. But you also have some anesthesia that they're in rooms for an extremely long time. Whether they're anesthesia, nurse anesthetists, or whether they're anesthesiologists, they're being pushed by these institutions to work, and they give them minimum return. They're not increasing their pay for working as hard, even though they're getting reimbursed a pretty good amount. Yes, reimbursements are going down nationwide, but in the hospital settings, they're not going down as much. So they can afford to pay for the people and people working, but they just choose not to compensate the provider for their services. It's across the board, whether it's IR, whether it's vascular surgeon, cardiac surgeon. If you work for a hospital, they're going to pretty much take advantage of you financially and not pay you what you're worth. They're going to have a board and they say this will go pay you and this is what it is. But they're not there taking care of these patients, putting their lives at risk, taking care of patients with HIV, taking care of patients with COVID. We don't even talk about HIV no more. I haven't seen nobody talk about HIV for a while. They're talking about COVID, and it's real. This ICUs are full, ventilators are taken, staff is down, staff can get sick, but you got to go in with this astronaut suit on and take care of somebody, and then they still treat you basically like the scum of the earth. Don't want to compensate you for your work, tell you how much they need you, but treat you like trash, throw you away. And overworked workers leads to mistakes. Overworked hours leads to mistakes. Overworked anesthesia personnel leads to mistakes. I don't care how good they are, a mistake is bound to happen. Whether you done stuck it in the syringe and you're about to push it, you're still about to make a mistake because of fatigue. Everybody needs rest. Everybody needs adequate staff at their facilities. At Vascular Anesthesia, we work hard, but we keep in mind that we try to get our people lunch breaks. They're independent practitioners. They move at their own pace. They're not worked like dogs. They're compensated well. We reset the market. Everything's on the up and up when it comes to vascular anesthesia. But you have these institutions that take advantages of all these healthcare providers. It's a shame. And, I hope it gets better, but it only gets better when people talk about it, and then change will happen.
I fell asleep last night, want to drive.